2022, he was appointed by President Biden as the White House COVID-19 response coordinator. And in my view, under very difficult circumstances, is doing an excellent job. Dr. Jha, thanks so much for being with us.
Senator Sanders, thank you so much for having me join you. I'm really excited and delighted to spend some time with you.
Okay. And folks, the reason why we're doing this is that people in Dr. Jha's position are often put in front of the media and they have 12 seconds to respond to very difficult issues. And meanwhile, people are reading social media and they're hearing this study and that study, and people say, what the hell is going on? So I hope we'll have a few minutes to get into a little bit more depth about some of the very serious issues surrounding COVID. Let me begin. And by the way, many of the questions that I'm going to ask Dr. Jha came from Facebook. We asked people to come up with, ideas that were on their minds, and we've incorporated those questions into what I'm going to ask Dr. Jha this evening. Let me start off with a very simple and basic question, Dr. Jha, and that is, look, we've been dealing with this pandemic for several years now. We've lost 1 million people. Tens of millions of people have gotten COVID. And I run into this. We're dealing with what I might call COVID fatigue. People are sick and tired of wearing their masks. They're sick and tired of not being able to go to a restaurant, go to a movie theater. So what do you say to those people who are just said, I've had enough with COVID?
Yeah. No, first of all, Senator, I think it's been incredibly hard, 2.5 years for our country. I mean, just extraordinarily hard couple of years. And what I remind people is that we are in so much of a better place than where we were even 1.5 years ago. When I think about when this president came into office, where we were compared to where we are now, I don't want COVID to be front and center on everybody's mind every single day. My gosh, we had that for almost 2 years. It's important for people to be able to think about other things. It's important for people to be able to spend time with family, go out to restaurants. And the good news is if you're vaccinated, you're boosted, you're up to date, you're taking basic precautions, you can do those things pretty safely. And that is the key message, is that it is much more possible now to live life, to do the things that matter to all of us, because we have the tools we need to do them. And we can do them safely. We can do it without putting people's lives and health at risk. And that means that, I've gone out to restaurants. I spent time with my elderly parents. These are things we can do safely now.
Okay, I want to get back to that issue that you just raised. But let me ask another one that is on people's minds. 100 and some odd years ago, we had the Spanish flu, a terrible flu. And then one day, or more or less, it kind of disappeared. Do we have any sense, and I know nobody has all the magical answers. One of the problems you have, I think, is that you and your colleagues, people demanding answers from you in what is a new phenomenon where we don't have all the answers. But could you give us your best guess? Are we going to be dealing with one or another COVID variant for years to come? Or might this simply one day disappear? What's your sense of how long we're going to have to deal with this?
Yeah, it's a very good question. And so as you started off with, none of us know for sure exactly how this is going to play out. But here's how I think about it. Is COVID going to disappear? No, probably going to be with us for the rest of our lives. But that should not necessarily be a scary or bad concept, because the bottom line is, the virus right now is evolving very rapidly. That's why we're seeing these subvariants come on every few months, major variants every 6 to 9 months. That may continue for a little while, but we're getting better too. We're updating our vaccines. We're going to have a whole new generation of vaccines this fall that are going to be very specific to the variant that's out there right now. So we're getting better in our fight against this virus. And what that means is over time, the virus will be less and less significant in terms of its impact on the population. Now, we may get a curveball. So we're going to always have to be ready for a curveball. If we get a curveball of more serious virus or a more contagious one, we're going to have to be able to manage that. But I think over the long run, Senator, with what the tools we have, the way we keep updating them, the way we keep building better treatments, I am confident that we're going to be able to stay ahead of this virus. Obviously, if we take our foot off the gas, right? We stop updating our vaccines, we stop getting new treatments, then yeah, we could slip backwards. That's what I want to make sure we don't do. I want to make sure we stay ahead of this virus, and I think we can.
All right, let me ask you a question, two questions related to that. Number one, if you could snap your fingers and make everything you wanted to happen, where would we be going as a country? What would we be doing?
Yeah, I think we are one of the biggest challenges we face as a country is all of the noise and bad information that pollutes our information landscape, right? If I could ask people to do one thing, I would say, please get up to date with your vaccines, get vaccinated, get boosted. Here's why. If you do that, and if you do then end up still having an infection, which we do see some breakthrough infections, you get treated. Basically, we can end almost every death in America from COVID. Like, I think we're at a point where 99% of deaths in America from COVID are preventable. That is a remarkable fact.
That is.
And and again, we have those tools. We have plenty of vaccines. We've got plenty of treatments. So it's really about building confidence, helping people understand why it's good for them, and making sure that we're doing our part in government, making it easy, free, accessible, all the things that government should be doing to help people get these things.
All right, let me ask you a question that I have heard out there. And I know the answer, you know the answer, but I want our viewers to know the answer. Hey, Dr. Jha, President Biden has taken all of the vaccines. He has been very, very careful. He got COVID. He got sick. And if he can get sick, anybody can get sick. So why are you bothering me with all this stuff?
Yeah. Yeah, I think President Biden is actually a great example of what success looks like here, right? Because here's President Biden. He's out there. I mean, he loves spending time with people. He's out shaking hands and giving hugs and just sort of as you know, he loves spending time with people, his constituents. And so there was no chance that with the contagious virus that we have out there, it was going to be very, very hard to prevent him or anyone else in his position from never getting infected. He got infected, but look, he had relatively mild respiratory symptoms. His oxygen level remained great the whole time. He never had a fever. He got through this virus and this infection with relatively little disruption from a health point of view. That is what success looks like. It is amazing to me that people somehow look at that and say, oh, if he can get infected. I'm like, no, this is a success story. Right. Here's a gentleman who's pretty healthy, but he's older, and he got infected, and he has done absolutely great. Thank God. And that is, I think, largely because his immune system has been well trained with multiple doses of the vaccine, and he was able to get treatments that are now widely available. I always remind people, he got world-class care because he's the president. But one of the things that he has said to me and to all of us is he wants to make sure that that same world-class care is available for free to every American. And that has been our guiding principle, and that's what we've been working on making sure happens. I mean, obviously, the president gets some specific things, but the vaccines and treatments, those are available to every American.
So you are arguing that what happened to President Biden is, in fact, a success story, that a 79-year-old guy had mild symptoms. He was out for a little bit, and he's back. And this is what we should be doing for every American.
Yeah, what I'm saying is we are now at a point where if people get vaccinated and boosted, if people get treated if they have a breakthrough infection, we can prevent serious illness and death. That has got to be our number one goal. I mean, obviously, we want to also reduce infection levels in the community, and there's a lot we can do there, and we're doing. But the number one goal has to be to stop the horrible levels of hospitalizations and deaths we saw in the first year and a half of the pandemic, and to make sure that we're doing everything to protect people's lives and health and well-being. And because the president followed the guidelines, took his vaccines, took treatments when he got sick, he did well. And thank goodness that he did well. And that's what we want to make sure is available to every American.
Okay, let's talk about vaccines. And we got a couple of issues, and that is too many people today are not vaccinated for a variety of reasons. Second of all, people who have received vaccines are seeing their immunity wane over a period of time. All right, what do you say with the latter question? What do you say to people? Well, I got my vaccine 6 months ago. What do you got for me now? How are you going to protect me today? What are we looking forward to in the future?
Yeah. Great questions. So here's what I remind people. We have a virus out there that is very, very rapidly evolving. Look, just in this year, we're in August. In January, the Omicron version we had was BA1.1. By March, it was BA2. By May, it was BA2.12. By July, it was BA.5. This is a virus that's evolving very rapidly, trying to escape our immunity. And so we have two choices. We can just sort of give up and let lots of people get infected. Obviously, that's not what we're going to do. Or we can make sure that people are keeping up with their immunity. And the best way to do that is to be getting boosted. So I have said multiple times, and I'll say very clearly, if you're over the age of 50 and you have not gotten a booster this year, I would still go out and get one now. I think it's really important to protect yourself. Now, this fall coming up, ideally in the next month or so, we're going to have a new generation of vaccines arriving. The companies are still making them. The testing is going on. FDA and CDC is going to do its job of making sure they're safe and effective. I'm very optimistic, but we'll look at the data. But assuming all of that works, we're going to have a vaccine. It's updated for the first time, and it's specifically targeting the version of the virus that's out there. I think that's going to make an enormous difference. It's going to reduce infections. It's going to reduce serious illness even more. So what I'm saying to folks is, look, while we're in the acute phase of this pandemic, I know it's not convenient, but maybe you're going to have to get vaccinated twice a year for the next year or two until we get to a better place.
Right.
But compare that to where we were. Like, my gosh, it's not so easy to get vaccinated twice a year. But the alternative is that we have people getting really sick and dying. It's really not that big a deal. And I want people to be able to do that to protect themselves and their families.
All right. So do you foresee for the future new vaccines being developed to respond to particular variants?
Well, that's what we're doing right now. Let's see how well this goes. I'm very confident, or I should say optimistic. We'll see the data, but I'm very optimistic that this one is going to make a real difference. We'll see where the viral evolution is. If the virus evolves a little, these vaccines will do great. If the virus evolves a lot, at some point next year, we may have to update the vaccines again. Don't know. We want to plan for multiple scenarios, always hoping, of course, that the virus doesn't evolve so much so that these vaccines will provide a very long period of protection. But whatever the virus does, whatever Mother Nature throws at us, the good news is we can respond to it, and we can respond to it in a way that can keep kids in school, can let people get back to work, or let them go to church safely, or do all the things that really matter to people. That's our goal. We want to make sure that those things can all happen safely.
All right. When we talk about our overall response, we're talking about vaccines. We're also talking about treatment. Okay. And we have made some progress in that area, very significant progress. More needs to be done. Talk a little bit about Paxlovid, other treatments that are out there, and talk about whether or not people know how to get the treatment. Somebody wakes up today, they test positive, okay? And they're really feeling pretty bad. How do they get Paxlovid?
Yeah.
How much does it cost them? Does anybody know that?
We do know that. So let's talk about Paxlovid, and there are other therapies as well. Paxlovid is a remarkable drug. I mean, it lowers your risk of getting hospitalized more than 90%. The data we're tracking from major health systems, it's cutting death by 95%. I mean, it's so rare to have a treatment that cuts death by 95%. It's widely available. What we have done in the administration is we have made sure that every major pharmacy chain, lots of local pharmacies have them. So you call your doctor, you tell them you're positive. Basically, anybody who's at elevated risk, in my mind, anybody over the age of 50, or if you're under the age of 50 but have significant chronic illnesses, you should be talking to your doctor. You are likely eligible for Paxlovid. How do you get it? You just go to a pharmacy, and it comes at the attractive price point of free because the U.S. government has bought the Paxlovid, already paid for it. So it's no cost to patients, which I think is very, very important. What if you don't have a doctor? Because there's some people who say, look, I don't have a primary care doctor. I don't know who to call. You go to covid.gov, and you look up Test to Treat. There are Test to Treat sites across the country. We're working to build more of them. You can go to Test to Treat sites. Many of them are telemedicine. Some of them you have to go visit. You get a test. If you're positive, you get seen. You get Paxlovid handed to you. You go home. So there are a lot of programs we're trying to build to make sure it's super easy for people. The biggest issue in my mind is if you wake up and you don't feel great, get a test, because if you're positive, there's a treatment that can make a big difference, right? And so I think there are too many people who are saying, oh, what's the point of testing? It may not make a difference. No, get the test, because if you're positive, you can get a free treatment that'll make a big difference.
All right, my own political sense is that we still have a lot more work to do to make people, not everyone's going to go to the website. And, so people wake up today with COVID, they're really feeling bad. I think we got to do a better job in making sure that people know how to get the drug. and that they know that the drug is free. Number
Absolutely.
two, Paxlovid is not the only treatment out there. What else
Yeah.
do we have?
Yeah, absolutely. So there are others. There's molnupiravir, which is, I know it sounds like a handful of a name, but it's another oral antiviral for people who can't get Paxlovid. There are monoclonal antibodies. These are infusions. Um, and again, basically still available for free. All of these have been. But one of the things that we're transitioning into, Senator, is, and you know this, in the last round, Congress decided not to support, not to fund COVID, kind of response. And what that has meant is we're running out of money for buying treatments, and we're having to move some of these things into the commercial market. That I'm worried about what the impact will be on access. I want to make sure. So we're doing a lot to buy at least some for uninsured and underinsured people. But monoclonal antibodies, these are these infusions that you can get. If you're not eligible for Paxlovid, it's a great choice.
What does that
Again,
mean?
you got to
that
talk to your doctor.
What does that mean, not eligible for Paxlovid? Why is one treatment better than the other? Why should I take A and not B?
Yeah, it's a good question. So, they're both great. Paxlovid is the one that the president got, so obviously it's a very good therapy. But monoclonal antibodies is what the previous president got. I mean, the Paxlovid wasn't available then, but it's a very good treatment. The people who are not eligible for Paxlovid are usually people who are on certain medicines that you can't stop that can cause a drug-drug interaction. This is a conversation you're going to have with your doctor, and if your doctor says, you're on another medicine that's really important, we can't do it, that's okay. Then you go to the monoclonal antibodies. There are a lot of infusion centers across the country. You go, you get the infusion, lasts about an hour. Again, it's free. You go home. It makes an enormous difference in protecting you against serious illness.
All right. One of the ongoing problems we have had since day one is that for a variety of reasons, people are not getting vaccinated. Why is that? And what do you have to say to those people?
Yeah. Yeah, it's complicated, right? There are many reasons that I think lead people to end up not getting vaccinated. For some people, they don't have trust in the healthcare system. And for some people, they have good reason not to. And if you think about racial and ethnic minorities in our country, if you think about African Americans in this country, the healthcare system has not always treated them with dignity and respect. And so one is not surprised when some people say, hey, for years you've treated me badly and now you want me to do this. There's a trust gap there. We've got to do our part in healthcare and public health to reach out, work with trusted voices, close that trust gap, because we're not giving out vaccines in a vacuum. There's a history in our country that we have to deal with, we have to confront. And so a lot of the work we're doing in the administration is saying sometimes we can be the voice of these things, but many times we shouldn't be the voice. We should have local community leaders, we should have faith leaders, we should have other leaders to be the voices on this. So that's one part. There are people who I think have just been poisoned with bad information, misinformation about these vaccines. And our job, again, is best way to counter bad information is with good information and with trusted voices. So we've been working with people across the political spectrum. We have been trying to work on getting more good information out there. But it is a challenge because there's still a lot of bad information. But I remind people that, vaccines are doing an extraordinary job. It is because of vaccines that things are so much better now than they were a year and a half or 2 years ago. And it's the best protection you can have for yourself, your family, and your community to get vaccinated and to be up to date on your vaccines.
COVID is not just obviously an American issue, it's a global issue.
Yeah.
What are we doing? What is the world community doing to make sure that every person on Earth, no matter how poor they may be, are getting the vaccines and the treatments that they deserve?
Yeah. Yeah, as you know, there are times when there are people in our country who say, oh, let's just focus on America. And of course, we want to focus on America. But I always remind people a global pandemic requires a global solution. And the good news has been that we are a generous country and we can focus on Americans and we can help the world get into a better place. So let's talk a little bit about what we have been doing. The president made a commitment to make sure that we vaccinate the world. And what that means right now, Senator, is any country in the world, any lower middle income country, not the wealthy countries, they're fine, they've got their vaccines. But any lower middle income country, basically, if they want vaccines, we've got plenty of vaccines that we're willing to donate, that we're willing to get to countries. So vaccine supply really is no longer the problem in the world. Now, what is difficult is there's still countries that are struggling with health systems, difficult time getting people vaccinated. This is why we have felt it was so important for Congress to support our efforts to get the world vaccinated. Similarly, we think that it's going to be really important for us to get treatments out to the rest of the world.
Right.
All the things that are helpful and good for Americans, Americans are benefiting from them. Europeans are benefiting from them. I believe that people around the world need to be benefiting from them. And really, there is no country right now, I think, that's doing more. But it would really help for Congress to step up and help us on this.
I agree.
I know you do. I don't mean to. I don't mean to cast
I-
anything on you, Senator. You've been great on this, but we need
I
to
know.
continue this effort.
I know. All right, while we're on vaccines again internationally, I've just done on my own curiosity. The Chinese have a vaccine, the Russians have a vaccine, variety of vaccines are out there.
Yeah.
Have those vaccines been effective? Do we know much about the results of those vaccines?
Yeah, there are a lot of good vaccines out there. So obviously the Moderna and Pfizer, the two vaccines that have been dominant here, have been terrific. Johnson & Johnson, also quite a high quality vaccine. The UK vaccine, AstraZeneca's vaccine, is very, very good. That's the one that India has also produced in billions of doses. That's made a big difference. The data on both the Chinese and Russian, the data on Chinese vaccines suggests they're probably not as effective as the Moderna, Pfizer, or AstraZeneca. There's just very little data on the Russian vaccines. There's a little tiny bit. It's not great data. So I don't have as much confidence in the Chinese and Russian vaccines. I don't think that they're going to end up being as effective as the vaccines that are being used in Europe, the ones being used in India, South Asia, the ones that are being used in Africa, or certainly the ones being used in North America.
All right, let me go to a subject which I think as a nation we don't discuss enough, and that is long COVID. I've have some people who have young people who are working for me,
Yeah.
who really had a tough time with COVID, and months later, they
Yeah.
still have symptoms. I think we worry that while children, thank God, are not dying, you correct me if I'm wrong here, we're not quite sure what the long-term impacts might be. Say a word about long
Yeah.
COVID, what we're trying to do to better understand the problem and perhaps deal with it over a period of time.
Yeah, thank you for raising this because, I do often end up talking about preventing hospitalizations and deaths, which of course is most important. But then people sometimes think, but what about long COVID? Are we not paying enough attention to that? Here's what we know. One bit of, I think, important information. A few months ago, just as I was starting in this role in early April, the president put out a presidential memorandum asking HHS Secretary Becerra to lead an all-of-government effort to put together a plan for how the U.S. government is going to be responding to long COVID. Those reports just came out last week, one on kind of what services are available, another on the research agenda. So I would encourage people to go and read those reports because they actually start giving you a blueprint of how the government's thinking about it. Now, my view on this is this. We know long COVID is real. We know that there are people who suffer significantly from it. Here's how I think about it. If you take almost any major viral syndrome, you take influenza, ask people 4 weeks later, about 20–30% of people still are suffering from some symptoms. So that's common with almost any major virus. That is not to say long COVID is not different because we are seeing, and again, the numbers are hard to pin down here, but 3, 5, maybe 7% of people 3 months later, 5 months later, still with significant symptoms that are really affecting their quality of life, their ability to work, their ability to do the things that matter to them. NIH is doing a major study, the RECOVER study, $1.3 billion, multiple sites, trying to both understand what's going on, and then starting to think about what are the treatments that we can try for this population. My feeling is it's probably not one condition, it's probably multiple conditions. For some people, it's immunologic. For some people, it might be persistent virus. For some people, it may be tissue damage from the original infection. We've got to sort all that out. And then we've got to take care of these people, provide whatever support they need from the government, but we got to make sure we take care of them.
Okay. In a few weeks, in parts of the country, schools are going to be reopening. What's your message to parents and educators as kids return to school?
Yeah, just today, Senator, CDC put out its guidance on schools. It's been getting very, I think, strong positive reviews from kids advocates, teachers unions, really everybody across the board. Here's the big picture point that I would make. We've had two incredibly hard years in terms of kids in schools. I've got three kids who are in school, in public schools, around the country, private school, everywhere. Like people have had a very, very hard couple of years. Um, we should look forward to a very different school year. We should look forward to a school year where every child is in school, in person, full time for the whole year. I think we have all the ability to do that, and that should be the only acceptable standard. How do we do it? First, it makes sure that kids are vaccinated. Certainly, adults should be vaccinated, but as you know, every child over 6 months of age is now eligible for a vaccine. These vaccines are incredibly good at preventing serious illness. So even though kids don't get seriously ill at the same rates, we do see kids still getting hospitalized. We can eliminate that or prevent that very substantially with vaccines. I really think it's important to improve indoor air quality. Again, thank you to Congress. We put billions of dollars out to school districts to improve ventilation and filtration. That'll make an enormous difference, not just against COVID, but against the flu.
Let me interrupt you because I think
yeah,
your
yeah.
point is a very important point. And I've tried to find out in Vermont how effective that has been.
Yeah.
Is it your perception that we are making progress in improving ventilation in schools? And tell people why why ventilation, in fact, is so very important.
Yeah. Well, let's talk about why it's so important. You know, it's really interesting, right? We all spend about 90% of our time indoors, breathing air indoors. And what it turns out is that COVID, flu, lots of respiratory viruses basically pass through the air. So when you have contaminated air because somebody's been in the room and they're coughing or even just breathing out virus, somebody else walks in there, they can inhale it, they can get infected. And what ventilation and filtration do is they just clean the air. These are, upgrades to your ventilation system. There are air purifiers. They're pretty cheap. You don't need super fancy technology. They make an enormous difference in reducing infections. But what's really remarkable, Senator, is actually there's very good data that when you improve ventilation and filtration, kids' test scores go up. I mean, it's like people's performance goes up. So it's an educational tool, right? Because breathing clean air makes an enormous difference. So this is where I do think, again, I know less about Vermont per se, but everything I know about Vermont public schools, I suspect they're ahead of the pack probably compared to most other places in the country. But a lot of schools have done it, but not enough. There's still a lot of schools out there with money, but have not made those investments. They still can. It's certainly not too late.
All right. So you're saying is in terms of indoor, for those of us who are going to be indoors, air quality is enormously important and a good ventilation system can make all the difference. I would think that a good example of that is airplane travel.
Yep.
I mean,
absolutely.
You tell me what I'm missing here, but I have not heard that a lot of COVID has been spread by people on planes. Is that correct or not?
Yeah, no, that is correct. That in general, airplanes do an amazing job of ventilating and filtering the air. I think it's made an enormous difference on airplanes. Where you do get COVID in travel is in the airport, maybe on the jetway, but the plane itself tends to be relatively quite safe. Again, compared to other settings. Hospitals, again, another place where terrific ventilation. There are great examples of where good ventilation has made a huge difference in keeping indoor air clean and therefore preventing infections.
All right, so we have got to make sure that schools throughout the country are adequately using the money that we appropriated.
Yep, absolutely.
All right, what issues have we not talked about that you want to say a few words on?
No, I think we've covered a broad range of things. The big picture point I want to make to folks is it's been an incredibly difficult couple of years. We still have to deal with this virus, but we're getting better and better at managing it. There are important things we can do to protect ourselves when infection numbers are very high in your community and you're in a crowded indoor space. We haven't talked about wearing a mask. Wearing a mask can make an important difference.
Say a word. Well, let me interrupt you there and ask. A mask is not a mask. There are better quality masks. Say a word on what we know about the differences in quality between masks.
Yep. Yeah, and the quality of the mask just makes a difference in terms of quality of protection. So if you wear a cloth mask, you're going to get, 10, 20% protection, not zero, but not a lot. And basically, there are two things that matter for masks. One is the fit, how tight a fit you have, and the second is the filtration of the material. So cloth masks don't give you great fit and they don't give you great filtration, so you get 10, 20% protection. Surgical masks, the kind that I wear when I'm in the hospital, I mean, these days I wear an N95, but before I would wear a surgical mask, they're more like 40, 50% protection. And because they tend to have really good filtration, but they don't give you that super tight fit. High quality masks, KN95s, KF94s, which come from South Korea, N95s. These things were very hard to get early in the pandemic. They're widely available now. And actually, one of the things that, again, the administration has done is if you go on covid.gov and you look up masks, you can find free masks in retail places across the country. These are high quality masks. They give you like 80, 90% protection. Against nothing is 100%, but they make an enormous difference. So I always encourage people, if you're going to wear a mask, wear the highest quality mask that you can wear. It will give you more and more protection.
And I know we work with the administration, and I think they have released hundreds of millions of masks.
Absolutely.
Okay.
We have. And part of it is, look, yes, you can go out on Amazon and buy it for $2 and buy a pack of 10 for $20 or $30. But, we really think in a pandemic, we should make this as cheap and as easy for people as possible. There is nothing kind of easier than if you can get into retail stores, Walmarts and CVS's, and it's available for free. That really makes a big difference for a lot of people.
It does.
So we have felt that that was very, very important for people to do.
All right. Say a word on testing. All right. Because this is what I think I hear from folks. They are concerned that, and again, the government has done a very good job in sending zillions of testing packages all over the country. But you tell me, I think those packages, those tests are not 100% accurate. Is that correct or not?
Yeah, I see it a little differently, Senator. I mean, what I'd say is this. The rapid tests you do at home, the ones that give you a result in 10, 15 minutes, they are testing for whether you're contagious or not. So it's a different test than the PCR test that takes 2 days to come back and costs 10 times as much and you got to go somewhere to get it. PCR tells you, do you have the virus or not? But the rapid tests are a contagiousness test. So it's true that sometimes you'll get a negative on a rapid and a positive on PCR and people say, these tests don't work. I don't think that's quite the way I think about it. The way I think about it is so when I go see my elderly parents, before I go see them, I will do a rapid test. Because the thing I care most about is I don't want to get them infected. I want to make sure I'm not contagious. And these tests are very good for that.
All right. So if you test negative on that home test, you are quite confident that you're not going to be contaminating anybody.
Yeah, for some period of time. Now, obviously, 24 hours, 36 hours later, it's not so. And then obviously, also, by the way, this is if you don't have symptoms. If you've got a fever and a cough and you sore throat and you test negative, no, all bets are off. You may still be contagious. So look, for symptomatic people, if you've got symptoms, you got to stay away from others who are at high risk. But if you're asymptomatic, you feel well, you want to go see someone who's high risk, a single negative test makes an enormous difference. Nothing in life is 100%, but makes a huge difference in giving you confidence that you're not going to get someone else sick.
Okay, I'm not sure everybody knows that. So I'm glad that you made that point. All right, anything that we did not go over that you want to convey?
No, I just want to say thank you, Senator, for your leadership throughout the whole 2 years and the opportunity to come and spend some time with you here. These are really important issues. We're not done with the pandemic as much as many people wished we were. But the good news is we keep doing the things that we're doing in partnership between Congress and the administration. I am very confident whatever happens next, whatever Mother Nature throws at us, we're going to manage it. We're going to keep people safe. We're going to keep people going.
Well, let me thank you personally for the great job you are doing and the administration for all that they are doing. So thank you very much for being with us. Look forward to chatting with you in the near future. Take care.
Bye-bye. Thank you.